Footage on Live Talk, and with me now is Dr. Syed Sakib Nazir. He is interventional cardiologist at FUH University Hospital. Welcome to the show, doctor.
Hello, thank you.
Hi. So, one of the things that I wanted to ask you is why are more and more younger people these days having heart attacks, and this is becoming a cause of concern?
Yeah, that's true. Basically, we live in a world where we would like to do things faster and faster. Younger people, they are in the middle of their career advancement, so they work very hard. They have hardly any time to relax, hardly any time to prepare meals for themselves, hardly any time to do exercise. So they have been just concentrating at their work. Now, what happens? Sedentary lifestyle because of lack of exercise, eating not healthy foods, getting it delivered by elsewhere. These are not healthy things. They don't get enough sleep. So what happens eventually? They started to develop what we called early cardiovascular risk factors. Now, these cardiovascular risk factors are, as you know, are high blood pressure, high cholesterol, high sugar levels, lack of sleep, and obesity is something which creeps up in the lifestyle. So these risk factors, they appear early in younger age group. And the problem is, as they are young, they feel that they are not vulnerable.
Right.
They don't go to the doctors for a checkup. They might have developed diabetes or they might have developed high blood pressure, but they don't go to the doctors because they are feeling well.
Yeah.
Now, the saddest part is, even if someone goes for a checkup and finds out that they have high cholesterol or high blood pressure, they may follow the doctor's instruction for a few months and they forget about it.
True.
So this is why it's not only in Dubai, it's a worldwide phenomenon now that younger people are having more and more cardiovascular risk factors having in their early stage of life, and hence they're getting all these heart attacks.
Right. But have you seen an influx of this or like an incidence of these heart attacks more in the younger people after COVID? Because we're seeing a lot more news about this.
Well, if you ask me scientifically, I think COVID does not correlate directly with heart attack, especially in post-COVID era. There has been a lot of studies, research were done so far into this matter. When COVID was there, yes, people were having heart issues, including heart attack, not in big numbers in younger population, but that era is finished now. So studies and research has clearly proven that the COVID doesn't have any long-term effect when it comes to the heart health.
Okay. You mentioned that, a lot of younger people don't have enough time to go to the gym. They're obese. They're eating wrong foods. While that may be true for a lot of young people, but we've seen videos of people being in the gym, being on the treadmill and collapsing because of heart and cardiovascular issues. So, would you say that it's just the lack of awareness, or even after doing the exercises, even after taking care? And I know of cases of friends who have been very fit, so to speak, but then they have had cardiovascular issues and they've gone through heart attacks as well in like late 30s and early 40s.
I am really glad that you have brought up this issue. People having heart attack or sudden death in a younger age who are supposed to be fit and healthy, going to the gym, it has happened to a couple of celebrities in India as well.
Yep.
Which surprised everyone. Now, I'm going to tell you a story because I would like to explain it with a story. So I've got this 38-year-old gentleman from South India. He came to my clinic with no symptoms at all. He just came to me and said, "Doctor, I've got this high cholesterol. It's been there for a while. Sometimes I take tablets, sometimes I don't. but I'm not sure what to do. I have seen a couple of doctors. I've taken the tablets for a few months. So, I go to the gym. I'm fine. Nothing happens. I say, okay, let's do your cholesterol checkup. And to my surprise, his bad cholesterol, what we call LDL, was pretty high. So he did this exercise test in our clinic, which he does on treadmill every day, or 3 days, 4 days a week, having no chest pain. And he didn't develop any chest pain. And the test was normal. Now, the technology has advanced. The treadmill test is an old-fashioned test. It can miss heart disease by up to 50%. So as a specialist with the clinical judgment, I thought I need to move into the next level. And the next level was CT calcium score. Now, let me tell you about this new, it's not new technology. It's been there for a long time, but we haven't been using it. I've been personally using it for the last 8 years. So it's simple CT scan, simple X-ray. Nothing goes inside your body, no contrast, no injections. Now, this CT assesses the health of your heart arteries by checking the calcium deposition. Now, this man surprisingly has significant calcium in his main heart artery. And as per the guideline, as you know, nowadays, doctors, they don't only treat patient by the experience. They follow the guidelines. They follow the scientific basis of it. So I told this gentleman, look, you are 38, you're fit and healthy, everything is fine. But unfortunately, I have picked up this anomaly and I need to do something. And he said, what do you want to do, doctor? I said, I want to do an angiogram. I want to take pictures of your heart arteries. And believe me, what I discovered, he had an 80% blockage in his main heart artery. So what I'm trying to tell here is few things. Number one, if you have a high risk factor, mainly high cholesterol, that's the worst among everything. If you have high cholesterol, if you have got high blood pressure, if you have got high sugar level, and especially if you have got family history of heart disease, father, mother having heart attack, stroke, angioplasty, bypass surgery in their 40s, 50s, you are at risk. You are carrying the gene. So if you are having these, you have a checkup, and that modern technology allows us to detect a severe condition before it's caused problem.
Okay.
Right? So he had the angiogram. There was an 80% blockage, which was being treated by putting a stent in.
Okay.
So, number one, we need to know where is my risk, number one. Number two, there has to be accurate diagnosis. Number three, once you have the accurate diagnosis, you deal with it. And remember, heart disease is a chronic condition like diabetes. It doesn't disappear.
Okay.
It's there till you live.
It can only be treated.
Right, for a time being, but it needs to be controlled by taking few tablets. So symptom doesn't matter. Now, the other thing is, then you may say, okay, that gentleman went to the gym, he was fine, or while he was doing treadmill, he dropped dead, but he was perfectly fine before going to the gym. So this is the dynamics. Heart arteries are like tubes, and there are bumps of cholesterol deposition, like speed breaker, Now, these speed breaker can be shorter, it can be taller. It doesn't matter whether these speed breakers are small or large. They are vulnerable to rupture like volcano. Okay? So when that volcanic eruption happened inside the heart artery, then blood clot starts forming immediately. So a 30% blockage, not giving any symptoms, but vulnerable to
Sudden
rupture,
right?
Eruption. It can cause a chemical reaction within the blood, which starts getting thicker and thicker, forming a clot. So a 30% blockage, which was sitting there doing nothing, all of a sudden become a monster and blocks the artery, causing the heart attack.
And within seconds.
Within minutes, within few minutes.
Okay, then, when that happens, heart attack happens.
That's correct.
All right. We'll continue talking to the doctor about this. It's a very interesting topic, why younger people are more prone to heart attacks these days. If you want to join in the discussion, 0586 86 1003 is the number to WhatsApp.
Talk Music, brought to you by insurancemarket.ae.
Who's the highest rated and the largest insurance platform in the country? Insurancemarket.ae.
This year's International Women's Day theme is Invest in Women, Accelerate Progress, and will focus on the 5th Sustainable Development Goal of achieving gender equality and empowering all women and girls by 2030. Join Muriel Desar and Vivek Sanil for a special live broadcast on Friday, March 8th from 7 a.m. We'll be live with a guest panel of women influencers to discuss the importance of this day in the Emirates. And what a better place to celebrate than Sofitel Dubai downtown, the idyllic oasis that blends urban sophistication with refined luxury. Daybreak, Friday, March 8th, live on Talk 100.3.
This is Talk 100.3.
This is Live Talk, and I'm Ronak Kotecha. We're in conversation with Dr. Syed Sakib Nazir. He is interventional cardiologist at FUH University Hospital, and we're talking about heart attacks in younger people. Doctor, one question has popped in on our WhatsApp from Ronita. She's asking, my BMI is normal, my cholesterol level is good, but I have very high triglycerides. How bad is that?
Right. When it comes to cholesterol, you've got good, bad, and ugly. So the good is HDL or high density lipoprotein. It has to be in a higher side. And then you have got the bad, which is triglyceride. These are larger particle of fatty substance. And the ugliest is LDL, the low density lipoprotein. So if you have high triglyceride, depending how high it is, yes, it is an independent risk factors to develop premature cardiovascular disease. Your BMI is fine. You may be having, healthy diet. Despite that, the triglyceride can be high. Healthy diet. Despite that, the triglyceride can be high because of the metabolism in the liver, right? It may be genetic. So the best thing would be to go to a specialist, have a consultation, try to understand where you are. Remember one thing, high triglyceride, high cholesterol may not be a threat now, but it may become a threat after a few years. As we age, our risk goes up. So go to a specialist, try to have an assessment. But if you have high triglyceride, it has to be addressed.
Right. For good heart health, how many times in a year should we get it checked, or how often?
Right. Now, it all depends your age as well. We have a very young age population in Dubai. I personally feel that anyone who has reached in their mid-30s should at least go to a cardiologist once, right? Have an assessment.
Once a year?
Yeah, once a year. And then you have to ask the specialist how soon I need to come back to you. Not everyone has to come, go back every year. Right. It's not needed. Right. So your first assessment is very crucial. And you need to ask the doctors when I should be coming back. But remember, if you are in your late 30s or early 40s, you need to visit a cardiologist, especially in Dubai, once a year, for sure.
Okay. And once the person comes to you in his 30s, what do you do?
Take a very thorough history. History is very important, starting from family history, the lifestyle, the habits and exercise. That give me an idea about his risk. And the usual blood tests we do are blood sugar, cholesterol, liver, kidney. So basically checking the vital organs. Heart checkup, ECG we do is a very basic test. It's not really required. Beyond this, we usually don't do any other test in a very young people.
Okay. But if the ECG is not picked up any changes, if it's normal, then all is well?
No, not really. There is the catch. A normal ECG does not rule out anything, right? Yeah. So it's up to the doctor. How is he going to accept that normal ECG? Like the normal stress test I told you about this gentleman, right? It was normal, but as a specialist, I have already calculated his risk and I said, no, we need to go beyond. So for a young patient, only blood test and an ECG and that's it, unless the doctor is suspicious of something else.
Okay, I'm going to ask you two very specific questions regarding heart attack. One is, how can one differentiate between heart attack pain and gastric pain? Because they are so similar.
Yes, you're right. You're very much correct. You see, any discomfort above the diaphragm, whether it's front of the chest or back of the chest, makes you feel a pressure. That's the commonest way of describing heart pain. Pressure, someone, a baby elephant sitting on the chest, or someone has tightened a belt. That kind of feeling comes, and it may radiate to arms, not necessarily left arm, both arms, shoulder, neck, even the jaw. And patient have a bit of sweating, shortness of breath. And believe me, heart pain is something that people will never forget. They will say, "Doctor, this is the first time I ever had the worst pain and I felt like I'm going to die."
Okay.
That's the description of heart pain. It's so severe. Whereas when it comes to acid reflux, is similar, but it doesn't make the patient frightened, right? It stays there, lingers there. But heart pain, especially someone is having a heart attack, it comes in crescendo. It keeps building up till the patient seeks help or collapse. So my suggestion is, sometimes it's very difficult to differentiate. But if you are having some pain and you are feeling unwell and you are frightened, now that's the word. If you are frightened, don't wait. Go to the nearest emergency.
Okay.
Now, say, we often see colleagues accompanying their friends, colleagues to the hospital. They see the patient. Remember one thing, if you have one or two risk factors, okay, like high blood pressure, you have got high cholesterol, or you have already existing a risk factor, and if you're having a chest pain which is making you frightened, don't wait. Don't think that it is gastric, because if this is a heart pain and if you're having a heart attack, sooner you reach the hospital, better it is. Because the longer you wait, your heart muscle is getting damaged and you are getting into higher risk.
Okay. Like you said, only minutes before
That's correct.
The inevitable happens. So if a colleague or a friend does show a symptom or a family member of heart attack, what are the best things that you should do?
If you're seeing the colleague is having the chest pain or something,
Something like you mentioned.
yes, the best thing is to call the ambulance.
Okay.
Right? I tell you why. Often we said, okay, get into the car, let's go to the hospital. Don't do that. If someone is unwell with a chest pain, call the ambulance. The reason being, they're quick to arrive. Rather than taking by car, you may be in traffic or something.
That's your doctor in Dubai. I mean, there are many countries where you also know that ambulances can take a lot more time.
Sure. So I'm coming to that bit. So say if you are in Dubai, call the ambulance, because there are paramedics who can do a lot of things and they can transport you to the hospital fairly quickly. So that's Dubai. If we are talking places where these facilities doesn't exist, then the best thing would be to give the patient aspirin. Okay, 300 milligrams of aspirin, just say take, swallow, because this is going to prevent sudden death or something by almost 18%. So you're immediately reducing the chances of death, right? Once you have done it, then as I said, you have to take him to nearest facility, even if it's not hospital, even if it's a clinic.
Correct. So sometimes what happened in my uncle's case, he was much younger, like he was in his 60s. In India, what happened? So my auntie gave him sorbitet, I guess. One of those blood thinners. Yeah. And then they went to the clinic and they did an ECG. I think a lot of time was wasted and eventually we lost him. So do you think diagnosing a heart attack at that time is important, or should you just start the treatment?
Like you said, the sorbet tablets which your auntie gave.
That was given.
Yeah.
And then they went to the clinic.
Yeah.
And then the doctor, instead of starting the treatment, did the ECG. Now ECG is wasting time.
No. When it comes to heart attack, that is the most important thing.
Okay.
Right? We are supposed to do an ECG within 5 minutes of patient arriving to ER.
Okay.
Because in my previous conversation, I said ECG is a basic test for a stable patient.
Okay.
But when we are talking about an unstable patient and when we are talking about chest pain related to heart attack, ECG is the number one thing we need to do. because there will be invariably changes, and that will allow me to do the treatment. Now, the treatment comes in the form of tablets, oxygen, injections, but the best treatment is to open up the artery by putting a stent in, as you know. It's called angiogram, angioplasty.
Correct.
Now, the international guideline is that this artery which is blocked needs to be opened up within 120 minutes. That means within 2 hours of onset of chest pain.
Okay.
Right? Entering to the hospital, it needs to be opened up within 90 minutes, because these are what we call the
golden hour.
Golden hours of saving the heart muscle and the life.
Correct. No, but why I said this is because the procedure of ECG does take a little bit of time, right? They put the gel and everything.
It shouldn't take more than 3 minutes.
Okay, so that's well within the time frame.
Of
saving someone.
Yes.
Okay. And if somebody is borderline cholesterol, should they be overtly worried, or what kind of changes they can make? I mean, here I would like to draw focus towards oil, because with so much marketing also today, we are no wiser on which oil to use. Cooking oil.
Sure. So any oil in larger amount is bad, if I put it that way.
Okay.
If someone says olive oil is good, I'm taking only olive oil, but I'm taking so much. If you're taking so much, then it's bad.
No, not
right.
so much.
So when it comes to edible oil, olive oil is certainly the best. And then any vegetable oil is good, but you need to use it in very little
low quantities.
Absolutely. That is the key, because in modern world, whatever refined oil we are getting, they're all healthy, right? You need to consume lesser and lesser oil. That's the main thing. Now come to the point of borderline cholesterol. Now this is very fascinating. You see, when the cholesterol is absolutely fine, we are good. When the cholesterol is very high, we know it's bad. So when you talk about the two extreme spectrum, we are fine. But the gray area is the borderline. Now, as a doctor, our role is to find out which borderline patients are at risk. So we should not just shrug off, okay, my cholesterol is borderline. No, sorry. What's normal for me may be abnormal for you. Okay, so I'm giving you statistics now. 50% of the heart attack patient has got so-called normal cholesterol. So say I'm giving you a number. You have a cholesterol, LDL cholesterol of 120. Okay, but you have other protective mechanism going on. You will not develop heart disease. But my cholesterol, the same 120, I may develop premature heart disease because there are other genetic things which may influence
factors,
this. Yes. So what's normal for you may be abnormal for me.
Right.
So this is the thing. You must go to a cardiologist. With all due respect to all these specialities, high cholesterol has become a topic of cardiologists now. Only a cardiologist can assess which borderline high cholesterol patient needs treatment and who doesn't.
Literally, how much is too much for each one of us.
Yes. So, absolutely. But as a rule of thumb, LDL cholesterol has to be 100 or below to stay healthy.
Right.
If you don't have any other risk factors. But now, if you have family history or if you have diabetes, then 100 is high.
Okay.
You know what I mean? So you're going to add these small risk factors. But if you're healthy, you're perfectly fine. You're 38 years old. You know, you eat healthy, you go to gym or you do regular exercise. 100 or below is your target.
But the crux of all it from talking to you is that only if someone like you tells me, I'll listen. I mean, for us, seeing those reports and feeling healthy is often a farce. You know, it's not even something that we should consider.
Yes. So I mentioned about the CT calcium score. It goes hands in hands with borderline cholesterol. In the past, we didn't have a tool.
Right.
Now we have a tool. We have this fantastic CT calcium score thing.
Right.
Anyone who is borderline having borderline high cholesterol, we do CT calcium score.
Right. Finally, one question has popped in. I will take before we end the show. We all lead a very busy life. So this question is: we don't have time to do any physical activity. Then, what should we do to ensure that our heart health remains good?
I would like to thank this person for asking this question. I love exercise. I've been doing it since my school days. If people come to me and say, "Doctor, I don't have the time to do exercise," I tell them, "You are lazy." I say it again. You are lazy, right? There are ways of doing exercise. Now, it doesn't mean you have to go to gym. Okay? There was a study published very recently with 50,000 volunteers. What they did, they divided these to two groups. One group works in retails, like, takeaways, McDonald's and whatnot, and the other group sitting in front of the laptop whole day. And the study confirmed that people who stays on their feet longer, they have lesser medical conditions. So the bottom line is, you don't have to go to gym. There is a new thing coming up called calisthenic exercise, right? Stretches, plunges, crunches, push-ups. Use them 15 minutes every day or 3 days a week, and you should be fine. Walking is also good, brisk walking.
Right, there are ways to do this.
Yeah, absolutely.
Right. Thank you so much, Doctor. This short session, but very, very informative and very focused on heart health. I guess going forward, everyone who's listened to us will understand that when it comes to heart health, the only foolproof, much more foolproof than anything else, is taking a word from a cardiologist like yourself.
I would like to also conclude something.
Yes.
I would like to also conclude something.
Yes.
You are correct. But at the end of the day, it's your health, your body. It's your ownership. You need to take the lead. Thank you very much for having me today.
Absolutely. Have a great